Hi, it's Sandy Wyllie. Welcome to my mental health channel where I wipe away the stigma of mental illness by talking about my own experiences and struggles having borderline personality disorder. I talk about anxiety, depression, narcissism, post-traumatic stress disorder, schizophrenia, the different type of therapies like DBT, CBT, psychoanalysis. I talk about all my different psychologists and the unethical ones that sexually abuse me, and a plethora of like a gazillion other related topics around mental health. But I only come on as a former patient of almost 20 years. I am not a licensed therapist. I want to make this very clear. I do not hold a degree in psychology, so I cannot diagnose you or give you a professional opinion. All I ask in return of you is to please show respect and kindness in the comments. Please be kind to me. Be kind to other people who comment. I love to hear about your own personal struggles, and I welcome any requests you might want me to do on future subjects here on this channel. Always welcome that, but just ask to please be respectful and kind. Now, if you're new to my channel, welcome aboard. Please hit that subscribe button on the right. And if you like what you see, hit that like button there on the left. And let's roll them and get started on today's video. Today, I'm going to talk about complex post-traumatic stress disorder. Now, I've been diagnosed with post-traumatic stress disorder, and I also have borderline personality disorder, as you all know. But this complex post-traumatic stress disorder is something new that I've learned about, and I think I have that. I don't have post-traumatic stress disorder. I have complex post-traumatic stress disorder, and I'll talk about how the two are different. First of all, I want to say one thing, that complex post-traumatic stress disorder is very much like borderline personality disorder because they're both trauma-based. They're both from a traumatic sexual, physical abuse that happened in childhood. Okay? So they're very much alike. The reactions are very much alike too. There's dissociation with both of them. It's like overreacting to situations that are, from past events, having nightmares, having, panic attacks from things that remind you of the event in the past. The only difference is with borderlines, we have a deep fear of abandonment, and we idolize people, and then we go from idolizing people to putting them, to devaluing people. Whereas people who have complex post-traumatic stress disorder, they don't have the fear of abandonment that borderlines do, and they don't go from idolizing to devaluing people. So that's the difference between the two, okay? Other than those two key differences, everything else really overlaps the two. So I want to get into this, how post-traumatic stress disorder is different than complex traumatic stress disorder, which is what I have. So I think I was not properly diagnosed. I'm not trying to diagnose myself here, but I'm just reading the literature and seeing that the doctors misdiagnosed me. Let's just dive into it now. Post-traumatic stress disorder is when something from the past, something traumatic that happened to you, is brought up in the present time. Something reminds you of that event, and, you react to that. You have flashbacks. Like, take, for example, say you had a perfect, happy childhood. You had no problem growing up. You had, healthy, mentally stable parents who treated you with love and respect and let you grow into your own person. But then later on, you went to college and you were raped at the college. Now, because of that event, okay, that became, of course, very traumatic for you. You suffered. You became fearful of walking alone. You became fearful of being on campus. You became fearful around other boys. Okay, even though you had no childhood abuse and a very healthy upbringing, you developed post-traumatic stress disorder from that one event that happened when, let's say, you were 21 in college. Now, other than that event, let's just say nothing else happened. That was the only time that you were traumatized. And as a result of that, you have difficulty sleeping, eating, you have flashbacks. Anytime something reminds you, like, say it happened at dusk, okay, like in the fall. Every time in the fall, you hate the fall now. When it gets dusk, when it starts getting dark out, especially around the fall, you start getting nervous and you don't know why, because, that's one event, okay. That's post-traumatic stress disorder. But complex post-traumatic stress disorder is different. It isn't just one event that happened, okay? It's just like with borderline personality disorder. It's because you were traumatized by many events. Many things happened. Many things happened to you, not just one thing. You had many traumas in your life. Maybe your father walked out on you when you were little. Maybe you were sexually abused. I mean, it was more than one thing that happened. That's why it's complex. And this is what's happened to me. I have complex post-traumatic stress disorder because it wasn't just my childhood, all right, that was severely abusive. I was raped as a patient. My son was raped too. My son was sexually abused as a severely handicapped child in his institution and where he was at. He was severely beaten in an institution. He was severely tortured. I was, physically assaulted by my psychologist. I was sexually raped by my psychologist because I could not give consent because he was a doctor in power and I was a vulnerable patient looking for mental health. And instead of getting better, instead of getting help with my abusive upbringing and past, he re-traumatized me by severely abusing me sexually, verbally, emotionally, physically. My son was severely abused, emotionally, verbally, sexually, and physically. The same as me. And because he's my flesh and blood, it was just as traumatic as if it happened to me. So I have all these traumas. So it's complex post-traumatic stress disorder. And it's much, much worse than post-traumatic stress disorder because that's just one trauma, okay? That's just dealing with something that happened in the past, where complex is dealing with these multiple things happening to you. Many, many things, not just one event. I'm not trying to put people down who just have like one horrific event that happened because that's horrible. I'm not trying to do that at all. All I'm trying to say is when you've been attacked over and over again, then it becomes a different ball game. You see what I'm saying? It becomes a different ball game. And it's not just trying to get over the one thing, because it's not one thing. It's multiple things, okay? So what happens with someone like me who has that and borderline personality disorder, like I said, the two overlap. The only difference is the person with complex post-traumatic stress disorder doesn't have the abandonment issues that the borderline does, or the black and white, like the the hero worshiping, and then the devaluing, the black and white, that the borderline. Those are classic borderline symptoms. Now, I have both, okay? I've been completely traumatized by my therapist when I was trying to get help. My son abused when he was trying to get help. So both of us were in a position, of being very, very vulnerable, trying to get help, seeking help. And our caregivers, the people who we looked up to, who were supposed to be responsible for helping us, they abused us. So it's added layers. As a result of this, I have insomnia. I can't sleep. I became an alcoholic in my late 40s, early 50s. I became alcoholic because I could not handle all the trauma that was happening, and it was, it got reignited. Like, how can I say this? Like someone drops like a cigarette that isn't put out. It was like, it was right there, all along, and it starts burning and burning, and slowly what happens is that little spark becomes a flame. And this is what happens to me over and over again in my life. It's like every time I come up from air, someone keeps pushing my head down under the water again. I cannot breathe because every time I try to come up for air, someone keeps pushing me down and pushing me down. And, and this is what the complex post-traumatic stress disorder is. Every time you come up for air, someone is like pushing you back down, trying to keep you under that water, trying to keep you from breathing. And this is what it's been for me. I can't eat. I've lost a lot of weight. I can't sleep. I'm a heavy drinker. I have nightmares if I do get any sleep, I end up having nightmares. So it's very hard to overcome this because we're not talking about one isolated event as we are in the post-traumatic stress disorder. The complex one, it is multiple things. And as a result, what do? I isolate myself. So I try to stay away from people and places that, are going to, ratchet me up. So I end up, really, isolating and self-medicating myself. I'm not trying to promote this kind of behavior of isolating yourself or self-medicating. I'm just telling you that it's been so difficult with me lately that I've had to try to do this just for my own survival rate. You understand? Just for my own survival, I had to, get away from anything and everything that reminded me of these past events. And I talked about in other videos how something, recently came up with my son that reminded me of when he was severely abused. And that brought the feelings back again, And it's like reliving the nightmares, reliving the nightmares, because it isn't just one event. It's many. And it feels like, I'm like all alone in it. No one can understand, I feel like no one really can get me or understand me because it isn't just like childhood traumas. It's, when I was an adult, it was when my son as an adult and as a child, so it's like I'm re-traumatized over and over again. And maybe some of you out there have this, that you have these same, you have complex post-traumatic stress disorder too, that you've been re-traumatized over and over again, not just in your childhood, but in your adulthood too, been traumatized for people. So maybe you feel instead of being hurt again, that to protect yourself, that you need to keep your distance from people and situations that will bring that up again. And I certainly don't blame you. At this point in my life, I'm done with drama. I'm done. I've said it before, you know, I don't want any more pain. I'm at my threshold, okay? I can't take anymore. I just can't. I can't physically endure. I'm going to be 60. I can't endure it anymore. You know, I have to self-protect. I have to protect myself at all costs. And if that means just living, you know, a peaceful life alone, then so be it. I'd rather just have no friends. I've mentioned this before in many videos. No friends. I said it's much better for me just to stay, you know, in nature, enjoy, you know, enjoy the birds, enjoy walking in the woods, just enjoy peace and harmony. Why do I need people? You know, because people only hurt, you know. Over and over again, it has been proven in my life that I'm much better off alone. Maybe you're different, maybe, you know, but it's okay. You can be different, whatever works for you, you know. I found that it's better for me not to be in therapy because the therapist raped me and physically abused me. It's not to have friends because they just used me and abused me. And so I don't have the symptoms as much when I'm alone. I feel because there's no drama, you know. Of course, what happened with my son again caused drama. And I talked about that in the last video. I don't want to really go into that again because I already covered that. But, you know, aside from that, I just feel so much better and at peace when I'm alone and just in nature, going for walks, appreciating, you know, the beauty, you know, in a sunrise, the beauty in the stillness in the woods, a gentle breeze, you know, on my face, instead of just surrounding myself with people who are going to hurt me over and over and over again. Let me know what you think. I'm not sure if complex post-traumatic stress disorder is in the books yet. If you're into that kind of thing, you know, reading those diagnostic books for psychology. I know they have, you know, post-traumatic stress, but complex, I'm not sure if they added that yet, but it is very real, and I definitely have diagnosed myself with that. Definitely, I definitely see. And let me know if you have that and what you think of that and what you do to relieve some of those symptoms. You know, let's have a discussion about it. I welcome all the comments. If you want me to talk about anything else, let me know. And let's have a dialogue here. Please comment, tell me what you think, and we'll go from there. Okay.